The government's response to the coronavirus focused on two provinces today. President Cyril Ramaphosa and the Health Minister Dr. Zweli Mkhize are currently in Mpumalanga. Earlier today, the Gauteng Health MEC, Dr. Bandile Masuku, visited the Nasrec Centre in Soweto. It's been turned into an isolation and quarantine site for COVID-19. Now, Gauteng is expected to have 120,000 COVID-19 cases by the end of July. This is how Masuku's visit went.
Good morning, everyone, and thanks for making time to join us to come and visit our first functional created quarantine and isolation center. This is a center that we built over a period of 2 months. It has got 420 beds for quarantine and 50 beds for isolation. It also has got a spare capacity of over 100 beds that can be activated when the need when the need arises. We are quite impressed. Firstly, the main thing that I was worried about, because it's winter and we all know how cold it gets in Nasrec, so I was actually quite worried about the temperature inside. But I think the installation of the high vac and all the air conditioning system has actually been very much impressive. It's quite comfortable in there. There are some few things that we have noted as we went around, even talking to staff and also talking to the patients who are here, these are things that we can be able to sort out going forward in terms of the hygiene and how we upkeep our pollution actually services. And it's a great honor to have such, and having to put up some of the beds in this space. And this is an area that we can use for pretty much very, very stable patients that just need a bit of observation going forward. But we are quite impressed, and Dr. Naidu, who's a center, we call him a CEO of this hospital, of this center, and we are working with physicians, particularly the physicians that are coming from Cuba are actually based here. We've got the clinical associates and some nurses who are based here. So we do a whole lot of work up in the morning when they need to be checked, and they've got support from Christian Paragwanas and Helen Joseph when they require more assistance. So it's one of these centers. We are putting up hospital beds now for patients who will be sick, who will be requiring some help in terms of observation. So we're finalizing that process today, and the beds will be ready in the next week or two, which will be quite helpful to decongest the hospitals around the south of Gauteng, including up to Sidibeng and up to Carltonville and so on. And thank you so much for making time to be with us.
The number of yes, we can cater for 420 isolation and 50 quarantine, as MEC mentioned earlier. We're sitting now with 130 isolation and 8 quarantine patients. And of that, the females are 2/3 of the numbers that I told you about. So we got now at least about 200 and plus or minus 200 beds that is available for isolation and 42 for quarantine. And I think one of the questions was with regards to the staffing. Yeah. The staffing here is, as far as the clinical part is concerned, it's mostly redeployed staff. Right? There are a few new nurses that were employed as part of the COVID stimulus package. And the staff that we have here now, as the numbers increase, we'll have to complement them. And those will be maybe new staff, newly appointed staff. But at the moment, it's all redeployed staff from the existing resources.
Okay. Sorry? Dr. Naidu.
Dr. Naidu.
First name.
Yeah, first BIS.
Yes.
Yes.
Yeah, this.
Okay, no,
okay, let me see the issue around the death.
Yes, no. We are talking. I'm certain you are talking about what you saw on the social media, which was escalated to the minister. Yesterday, we dispatched a team from the MEC's office to the family, and it's not really in a quarantine facility. It was in a hospital in Tembisa. That incident where it occurred. We are investigating. A report will soon be shared with the family and shared with the public and with the minister of the circumstances, surrounding that particular aspect of food provision, and certainly the issues surrounding his demise. We like to send our condolences to the family and also to the community and friends that actually knew him. The whole process will be followed in terms of our own quality assurance report, and then we will take further action and be able to provide that information to the public. It's a regrettable circumstances, the way it sounds and how it came across, and it's something that we wouldn't want to see it happening anywhere in our facilities.
Let me see, there's a question that I think maybe you can elaborate a little bit more in terms of the additional capacity that we are bringing into the health system. But I don't think it was just meant for just here. It was just a direct question to say, are we relying only on the staff complement that we have, or are we bringing in additional capacity into the health system to assist with this?
Yes, we have been procuring and contracting a lot of staff, particularly for our existing facilities like Bara, Tembisa, Kalafong, and all other hospitals. And some of these facilities will also be actually run purely by people who are coming from outside the department. We are also creating a central reserve force, which will help us to replenish where there is a shortage and where there is a need to even rest some of our staff members. So this process of contracting and hiring, employing staff is a continuous process. It's not going to stop anytime soon. The more the better, and we'll be able to manage patients properly.
Thank you, Mrs. I'm allowing the last round of questions before we allow the two people that have agreed to talk to us to come out. Can I please take those that are asking for the first time, and then just, if you want to repeat, just listen first if they're not asking the same thing that you want to ask. I see a hand here. It looks like there's only one follow-up hand, so I'll give you that chance as well. You can start.
Can you just clarify again oxygen supply at this facility and what type of patients are admitted?
No, there's no, at the moment, there's no oxygen supply. We're looking at various options that we can be able to actually put up. One of the options is to have concentrated oxygen. And the patients who are here are patients that, in essence, don't require much medical intervention, except observations that will be done in the morning in terms of temperature and also other vital signs. So in these types of facilities, it's only very much stable actually patients. But we are not ruling out the fact that we might have to at some point escalate the service, as we are putting up extra hospital beds for patients that will be requiring intervention. It might mean that if the numbers increase, we might need to increase the capacity here, because I think it is basically suitable to cater for such, only if it has got staff and also the equipment that is necessary. There have not been any deaths in the facilities of quarantine. That's the first one. I think let's also dispel, I think it's a rumor, and sometimes people do spread fake reports and fake news. And that's the reason that some of the times we come out as the office of the MEC to ascertain some of the things. This visit was not a pre-arranged visit, it was a surprise visit, so that we can be able to get the actual situation as it actually occurs. Yes, indeed, all of us understand that Nasrec do get cold, but if you enter the air conditioning system that has been put into place, the high-vac system that is put in place, I'm pretty much impressed with it, and the temperature within it is very much quite friendly actually to patients. And I think if you do get a chance, you can actually also from your side able to appreciate it. But I think it's important that we must always, when we get reports, particularly in social media, we have to make sure that we verify the veracity of the reports, because a lot of wrong news and fake news do spread, and they spread quite quickly, and they create a very bad perception in many areas, including the issue of the death. So in the facility like this, we have not had any or report any deaths in this respect.
I'm finishing my quarantine today because I've already started at home with my kids who were also positive. They quarantined at home. As for me, my first time here, I got a welcome from the nurses. I was given a bed. It's separated in cubicles, but for me it was comfortable. And then when you needed help from any nurse, they help you with whatever you'll be asking for. We were giving food at the right time. The place was clean. For me, there's nothing that I can complain about. Yes.
Okay.
That is all, yes.
I think I'll allow a round of questions just to get further clarity, because you can imagine. Yes. Yeah, because you can just imagine she's just sharing experiences, but obviously maybe there's certain clarities that you need. Any rounds of questions? In the hand, there's one raised. Okay, I see the same hands as last. Yourself and yourself. Mama, when you address now, you can just look that way, even though the question comes from this side, that you are always facing the cameras. They will ask questions one by one. I think, let's go. There's only 3 hands that I saw. Let's start with the first hand that I acknowledge.
Sorry, Ma, for Porto, right?
Yeah?
I just want to know, you're not worried about any stigmas when you're going back home? How was the reception at home when you were coming here? Because a lot of people have stigmas around people who've got COVID-19.
She will respond, then we go to the next question.
Okay.
So them one by one.
That one I know about it. I've already dealt about it. We are staying in a complex where I'm from. So they already knew our neighbors because they are the people who are associating with us. My husband went first because he was the one who tested positive. He's a nurse at Charlotte. Then we had to test after him, after the result came positive. Then me and the one kid of mine tested positive. But the stigma, I know about it. I think by the time when I was here, I've already cancelled myself. I know the stigma is there, but I think I can deal with it. If I had my way, I would have been quarantined myself at home. But we are staying in a small flat. We are 5, actually. I didn't count my helper. My husband went away for his quarantine, and then me, I asked my doctor to get me a space as well, so that at home it must be only my helper and my kids, so that we must not clutter. Yes. Yeah, counseling. I think the whole of my family. We talked about it with my husband. We really gonna need a counseling because my 8-year-old child who did not test positive, she tested negative. She is very traumatized. So I think as for the family, the whole of us, we really gonna need counseling, just for her to be calm. Yes. She is even scared to go back to school. Yes.
Thank you. One fact that we can
Okay.
It's, in terms, I was told now by Dr. Naidu that there was a patient who passed on here 2 weeks ago. Was a 56-year-old gentleman who came in without symptoms, and he complained on shortness of breath. He was hypertensive, diabetic, and also RVD positive. And I just wanted to correct that fact so that we don't create a wrong impression.